So I work at the College of Pharmacists of BC. We are the regulatory body for pharmacists. Our role is no different than the role of the CMT-BC, although our registrants are pharmacists and theirs are registered massage therapists, okay? What I wanted to do is kind of give you some parallels to what's happening in our profession, because I think there might be some parallels that you can relate to within your own. I've got a brief PowerPoint that I want to go through that should point out some of that, and then I think at the end of all of the speakers here, we're going to do some questions if you have any. So the first thing I wanted to start it with is that there's stuff that's happening in healthcare, full stop. Dr. Carr definitely talked about it in kind of general terms, but that are affecting all of us as healthcare professionals. And it's not a secret that there is a big strain on the healthcare system in this province. It's not in this province, it's in this country. It's not in this country, it's around the world, right? And it's being driven in BC by some kind of facts. There's about 200,000 British Columbians that apparently don't have a family physician. This is a huge crisis for healthcare in this province. The baby boomers are getting older. We're about to plateau. In 10 years, by 2020, there will be 4 times the number of British Columbians over 65 years old than there is today. Think about that for a second, 10 years, and think about the strain that's going to have on the healthcare system. The other not so big of a secret is the fact that healthcare expenditures are nearing about 50% of government expenditures right now. These are realities, these aren't myths, this isn't maybe someday this is going to happen, this is what we're all faced with. Pharmacists are faced with, physicians, chiropractors, registered massage therapists, all of us. And it's driven some change in what's referred to as government health reform. And what government health reform is saying is a call from government to every regulated healthcare profession, which there's 22 or 23 of them in this province, I can't keep track, but to all of us to do one thing: step up to the full scope of our work. The government is saying this to us for one reason. We have no more money and we have no more resource to put into the system. We need those who are working within the system to step up and do more to generate better health outcomes for British Columbians. It is pressure that is being put on all of us, and we certainly as pharmacists are feeling it. So that's the kind of reality that we're living in, the regulated healthcare reform. The other reality that's happening as an evolution in healthcare is the model of healthcare has evolved. It used to be a traditional model where most people entered healthcare through a physician. You went to a doctor, the doctor did a diagnosis, and the doctor then decided these are the people that they're going to call in to treat you, right? That still happens. But what's driving healthcare more today than ever is a patient-centric model. And that's where the patient is in the center, and they're saying, hey, I'm responsible for my own healthcare. I'm going to decide who's on my healthcare team and who's going to help make me a healthier individual. And that is adding yet more strain onto an already strained healthcare system. So these are just the realities that we're all facing. So what has it meant in the profession that I work in for pharmacists? It's meant a lot. I've been at the college for 2.5 years, and in the last 2.5 years, pharmacists have been asked to step up to the plate in a number of different cases. For the last year and a bit now, pharmacists have been granted the authority to adapt a prescription. What this means is that a pharmacist, without having to get prior authority from a physician, can do their own analysis and assessment of the patient, use their own clinical decision, and based on their own professional judgment, make a decision on whether or not I will actually fill that prescription, whether I will renew it, whether I will change it, or whether I will substitute it for a different prescription. If it is in the best interest of the patient, a pharmacist has the authority, in many cases, to do that without seeking permission from the prescriber. Right? We are being asked to step up to the plate. The reason that we're being asked to do this is because, remember what I said, 200,000 British Columbians don't have a family doctor. Right? We need to take work away from the doctor so that those doctors can see new patients. This is a way that pharmacists are being asked to step up. Last fall, pharmacists were granted the authority, an expanded scope, to actually pierce the skin and offer injections. Pharmacists can now do this as an independent part of their scope of practice. So what's next for us? Actually initiating a prescription. And this isn't pie in the sky. This exists right now in many jurisdictions around the world. Pharmacists in the UK for years have actually been able to initiate a prescription. What I mean by initiating a prescription, a doctor does a diagnosis. A doctor says, I'm sorry ma'am, but you have high blood pressure, right? You go see a pharmacist, and the pharmacist will decide what drug therapy you need to be on to treat your condition of high blood pressure. That doesn't happen today in BC. It happens in Alberta. Pharmacists in Alberta have the authority to initiate prescriptions. It's not a question of will pharmacists be able to do this in BC. It's when, right? This is coming for us. There's a lot of change that's going on in our profession. We are being asked to step up to the plate. And remember I said this is a global thing. This isn't just for us here in BC. The World Health Organization, as an example, has said that the role of pharmacists needs to be redefined and reoriented. Closer to home, there's a publication called the Canadian Blueprint for Pharmacy. It's a Bible. It's a document that about a year and a half ago was signed by every regulatory college across this country, every pharmacy association. It is the vision for pharmacy practice in the future and actually today. It says the status quo is not an option. Pharmacists must shift from a product-centered to a patient-centered culture of care. This is what's being asked of our profession. We're not doing it. We're not stepping up. That's the problem. That's the reality. In fact, in January of this year, the Canadian Pharmaceutical Journal, or Pharmacist Journal, which is kind of our Bible publication nationally for the profession, has actually featured their article saying, "Are pharmacists the ultimate barrier to practice change?" So why aren't pharmacists doing it? Government wants us to. Patients want us to. The healthcare system needs us to. Why aren't we doing it? Well, two of the biggest barriers are barriers to change everywhere. Time and money, right? I'm already doing a full lot of work. You're asking me to do more? How am I going to get the time to do it? Fair enough, it's a barrier. What we're doing to overcome that barrier in pharmacy is we're going to regulate, we're going to create a whole new regulated healthcare professional. We'll have them in this country by the fall of this year in a pharmacy technician. We're going to say, okay, you know what, pharmacists? You're spending way too much time behind the dispensary counting pills and not enough time making decisions about drug therapy that's going to create a better health outcome for your patients. So we're going to give you more time because we're going to take that technician who works in a pharmacy right now, who is a completely unregulated person. You could show up tomorrow in a pharmacy and be filling a prescription. God help us. To address the time barriers, we're going to regulate that professional so that now a technician who's going to be responsible for the technical aspect of filling a drug is going to be regulated, so we know they have the skills to do that, so a pharmacist can get out from behind the dispensary and get into their patients. So that's time. Money. Money will always be a barrier. Show me the money. I don't want to do something until I know I'm going to get paid for it. Well, you know what? At some point you just got to step up and do it, and the money will come. We are in negotiations with the government, or the association is, around the money, and there will be a shift in money to cognitive services away from dispensing, but that will come in time. But neither of these two things, which are barriers to any kind of change, are the biggest problem. The reason that pharmacists are not stepping up to the plate, and what we have discovered, not just in BC, but around the globe, as pharmacists are being asked to do more, the barrier is knowledge. They don't know enough. They don't know enough.